In this short video, I'm going to talk a little bit about non-specific shoulder pain. A lot of patients would get referred to see me in the clinic because they have ongoing shoulder pain and discomfort, and they may also have a complaint of weakness in the arm. More often than not, when we test the nerves, they all show up as normal. And this is largely because the non-specific shoulder pain is more musculoskeletal in nature rather than nerve injury induced. Obviously, it is important to have the nerves checked. What can happen over time is that there may not be one particular trigger. It may be minor traumas over time, just from use of the arm. If you do activities that involve your arm to be above your shoulder, any upward movement like this, and you're doing that repetitively over time, you may end up with discomfort in the shoulder. What can then happen is that the muscles that are causing the pain will not be used as much as muscles that aren't causing pain, and this can overall lead to an imbalance of the function of the muscles around the shoulder region. So it's important to state at this point that if your shoulder pain or discomfort came on in the context of an injury, or the pain came on very suddenly, or you are experiencing focal weakness, like you are unable to open a jar, or you are unable to lift your arm above a shoulder level, you should probably have that checked out by a healthcare professional before starting these exercises. They probably will still be safe to do and still be beneficial, but it might be better to just get that type of thing checked out. In the next videos, we are going to be showing exercises that focus on stabilizing the muscles of the shoulder, as well as strengthening and stretching the shoulder muscles.
We're just going to go through the anatomy of the shoulder here, and we'll go through the major bones and also the major muscles as well. So you've probably heard of the shoulder blade before, or what's more commonly known as the scapula. So you have two scapula and they sit at the top of your back. So this is the inside edge of Jennifer's right scapula and it comes out to her shoulder here. And then this is the inside edge of Jennifer's left scapula and it comes up to the shoulder there. So the scapula are actually a really important bone because they connect into the shoulder, and you need to have correct smooth movement of the scapula in order to have normal pain-free shoulder movement. So I'm just going to hold Jennifer's arm for a second and we'll bend the elbow, and I'll just show you how the scapula moves in and out as Jennifer moves her elbow. So you can imagine if you have problems with your scapular movement or problems with the muscles around your scapula, how that might cause shoulder pain. So what we're going to target with our exercises is muscles that strengthen both around the scapula and the shoulder itself. So some of the muscles around the scapula include the serratus anterior, which is a large muscle that runs in on the side of your upper ribs and then runs along the inside of the scapula and under the scapula. Some of the other muscles are the rhomboids. You have your rhomboids major and minor, which run sort of in an upside down V pattern from your scapula up towards the bottom of your neck. And they work together to help the scapula to move correctly in and out. You also have then your trapezius muscles. So you've probably heard of your traps. So you have your upper, middle and lower traps. So your upper traps, you'll often hear of people complaining of pain or tightness at the side of your neck, which would be your upper traps. And then you also have your middle and your lower traps, which help to facilitate that correct movement of the scapula as well. Another really important set of muscles around the shoulder joint itself are the rotator cuff muscles, which you've probably heard of. So it's quite common to have rotator cuff issues that would cause shoulder pain. So they're a set of 4 muscles around what we call the glenohumeral joint or the shoulder joint. So it's where the top of your humerus or your long arm bone attaches into your shoulder socket. So those 4 muscles wrap around the head of the humerus and they act to stabilize the shoulder joint and also to facilitate some of the shoulder movements that we're going to talk about in a moment. So we're just going to stand up now and demonstrate some of the movements of the shoulder. So our first movement is shoulder flexion, which is bringing the arm up straight ahead. We also then have shoulder extension, which is bringing the arm behind. We have shoulder abduction, which is bringing the arm out to the side. And we have shoulder adduction, which is bringing the arm back towards the body. We also have internal rotation, which is bringing the arm down and in like that. So we're internally rotating at the shoulder. And we also have external rotation, where we're rotating the humerus away from our body. And it's also important to note that we can combine these movements as well, like we would in everyday life. So for example, if we're reaching for something, that would be both flexion and a bit of abduction as well. This video is going to go through some simple shoulder stretches. So if you do have pain or stiffness in your shoulder, these can be helpful to do throughout the day, or you can do them before your normal exercise or before your physio exercises. So we'll just start with some slow shoulder swings. So this is great for loosening out the shoulder. We're going to do it nice and slowly, feeling the movement. And only do this exercise if it's comfortable for you. So what we're going to do is we're going to do 10 forward and 10 back on each hand. So if you'd like to follow along with this video and do your stretches, you can. Great. So Jennifer is just moving on to the other hand now. Same thing again, 10 forward and 10 back, nice and slowly. Only do this if it's comfortable and you're just feeling that shoulder movement as you bring the arm forward and then back. This next video is called a one arm hug, so it's just a great stretch for the muscles at the back of your shoulder. So Jennifer is going to gently bring one arm in towards her and just pulling with the other arm, and you should feel this stretch down the side of your arm and then possibly down at the back of your shoulder as well. Great. So we're just holding for 15 seconds either side, and we want a nice gentle stretch where you can feel the muscle stretching, but it shouldn't be uncomfortable or painful. This stretch is called a chest opener stretch. So people often have tight pec muscles, which are at the front of our shoulder, and Jennifer is just demonstrating a great stretch for this. So you should feel a stretch at the front of your pecs from the front of your shoulder down into your chest. And we're going to hold that stretch for 15 seconds. So this is option 2 of your pec stretch. So it's a follow-on to the chest opener stretch. So if you're feeling a little bit of a stretch but you'd like a bit more of a stretch, you can come over to the wall. So ideally you do this in a doorway or somewhere long and tall like this, where you can put your elbow up against and have something firm to hold on to. So you're just going to bring your elbow up against the wall, have a nice firm support, and then you're going to turn your body sideways and you're going to lean into it slightly, and you should feel a stretch along the front of your shoulder and down into your chest as well. So you can hold this for between 15 and 30 seconds, and then you can repeat on the other side. This next stretch is called a tricep stretch. So your triceps are the muscle that runs along the back of your upper arm, and they can sometimes be tight. So Jennifer is just demonstrating this stretch here. So she's brought one arm up behind her, and then she's using that other arm to pull slightly more upwards just to facilitate that stretch. So only go as far as is comfortable. You should feel a mild stretch, but it shouldn't be uncomfortable or painful. And then you just repeat on the other side as well, and you can hold for between 15 and 30 seconds. This next exercise is a shoulder flexion stretch. So you can do this exercise either with a band, as Jennifer is demonstrating, or you can hold something like a broom handle just to keep both your arms fixated in place. So Jennifer is just showing the movement now. So she's brought her hands up as high as she can, and she's just going to hold that movement there for between 15 and 30 seconds. It's important to note that some people may not have full shoulder flexion range of movement. So full movement would be the 180 degrees or all the way up to the top as Jennifer is demonstrating. But if you can only get to about here, that's okay as well. Just hold it as high as you can and as high as is comfortable.